Hello everyone. This is next in the series of image to diagnosis, and this topic, this is one of the topics in the series of differential diagnosis, where we will discuss differential diagnosis of a particular the conditions which produce a particular image. Here we see three vessel trachea view at anomaly scan of a fetus, which shows an additional vessel in the 3VT. So instead of normal three vessels, you see a fourth vessel, which is seen. This appearance is seen in a supracardiac TAPVC and also in double superior vena cava. So how to do the differential diagnosis of these two conditions of supracardiac TAPVC versus double SVC? If you are interested to know the various steps in the differential diagnosis of these two conditions, please log on to sonoshare.in, go to image to diagnosis fetal medicine, and the fetal echo third case. You can click and listen to the lecture. Thank you for your attention.